Hello, everyone, and welcome to this presentation on mental health during COVID-19. My name is Taylon Sad. I'm currently a senior at Valley City State University in Valley City, North Dakota. Some background information on me. I'm originally from Lisbon, North Dakota. I'm a member of the VCSU track and field team. I'm a former secretary and former treasurer of VCSU SHAPE, and I'm currently a fundraising co-chair for VCSU SHAPE. I'm currently student teaching right now in my last semester of college, and I'm set to graduate this May with a bachelor's degree in physical and health education with a certificate in coaching. I want to thank ND SHAPE for this opportunity to speak on what I believe is a very important topic, especially in these times of COVID-19, that being mental health and mental health issues. We all know the physical aspects of the virus and what it can do, but I believe it is important to look at the mental health side of things. Because with COVID-19, there's a lot of stress, anxiety, depression, panic that comes with it. Could be a loss of loved ones, unemployment, and a bunch of other things that we will go on later on in this presentation. So on the agenda of this presentation, first we will go over an introduction, kind of an overview of everything in this presentation, all the information regarding this presentation. Number 2, we have mental health status on younger adults, older adults, teachers, and students, showing you different statistics, different percentages of how many of each group has had to deal with one or more mental health issues. Number 3, tips and useful resources to help cope with stress and anxiety. With everything bad going on, it is easy to look at the negatives with everything going on with COVID-19. With this point, upon doing research, I have found tips and useful resources to share with all of you on how you can cope with the different stresses and anxieties that plague you with the COVID-19 pandemic. So with this introduction, first of all, I want to explain why I was interested in this topic. I was interested in this topic because of my own mental health struggles during COVID-19. During COVID-19, at the beginning of it, like many of you, like all of you, we were forced to go online for school, whether from a teaching standpoint, trying to teach virtually, or from a student trying to learn virtually. For me, being a college student, my grades were doing tremendous. My grades were going up, and when the COVID-19 pandemic hit and we were all forced to go online for school, I figured that was not going to be good. My grades were going to drop, and all the hard work was just going to go down the drain. Thankfully, though, that did not happen, but for a lot of students, that was the case. I used this presentation for a class last semester here at VCSU. So I've done plenty of research with this presentation on the different tips and stats that come with the mental health aspects of COVID-19. Looking at it from a college student standpoint, along with school, like I said before, I'm a student athlete at VCSU, so my track and field season was cut short, and I was unable to see my friends, unable to socialize in person with my friends. So those were two things also that hit me hard. The message that I hope to bring with this presentation, though, is not only provide stats, but provide the main message that I want to bring is that even with all the bad things going on with the pandemic, there are ways to cope with everything. Of course, like I said before, I will be showing different statistics of certain age groups and how many of them have had mental health problems and the ways to cope with stress and anxiety. And being specific to you, the audience, the teachers and students on how to cope with the difficulties of online learning or a hybrid learning environment. So, moving forward, here are some of the factors that have affected people's mental health during COVID-19. Of course, the social isolation. At the beginning of the pandemic, everyone forced to quarantine for 10 or 2 weeks. And of course, if you have had COVID-19, like I did in October, just 10 days alone in my room, secluded, can't really go anywhere, can't go anywhere. It was tough. Aside from homework and video games, I had nothing else to do. And that was hard on me because while I'd like to be an introvert sometimes, if I go a period without seeing friends, I just get bored, and that boredom turns to anxiety, and it's just not good. Going on with unemployment, as we know, millions of Americans have filed for unemployment due to the pandemic. So the financial struggles, not being able to pay bills, not being able to put food on the table, that adds, of course, a lot of stress and anxiety as well. Of course, as we talked about, the distance and hybrid learning and teaching for teachers and students. And then, of course, the overall fear of getting sick and the loss of loved ones. So here are some general statistics that I had found. These percentages coming from the CDC, the Center of Disease Control. These percentages came from a survey done by the CDC in the last week of June to see how COVID-19 was truly affecting people's mental health. Overall, 40.9% of respondents reported at least having one adverse mental or behavioral health condition. 30.9% of those respondents included having symptoms of an anxiety or depressive disorder. 26.3% said that they had symptoms of a trauma and stressor-related disorder, or a TSRD. And 13.3% of those respondents said they had started or increased their substance use with drugs and alcohol to help cope with stress and emotions related to COVID-19. 10% of the respondents said that in the 30 days prior to completing the survey that they had contemplated suicide. That percentage was significantly higher, with respondents aged 18 to 24 at 25.5%. So a very high percentage of people who had contemplated suicide because of the stress and anxiety due to the pandemic. And that is why I have prepared this presentation. This is why I'm passionate about it, because this information, along with the tips and resources, I believe, when shared with others, can help save their life. And then, of course, at the bottom there, you see the minority groups that were also affected. 18.6% of Hispanic people and 15.1% of African Americans reported also having one or more mental health issues due to the COVID-19 pandemic. Moving on with statistics, this having to do with the older generation. The older generations have also been hit hard because of COVID-19. According to a study done by Indiana University, older adults experienced greater depression and loneliness during the COVID-19 pandemic. 2/3, or 68% of older adults, reported spending less time than before with people they loved, according to the study, and 79% felt like their social life decreased or was negatively affected by COVID-19. There was some good news, however. 60% of older people reported spending somewhat or much more time reconnecting or catching up with people they cared about, and 78% were using some form of internet technology to keep in touch with family members during the pandemic. On average, older adults reported spending about 76 minutes socializing virtually or over the phone each day. So with those With the older generation, um, some of them had not had these opportunities, and so the pandemic has been very hard on them. For the older residents, the older people with these types of technologies, they were at least able to communicate with family members and loved ones, but it wasn't the same. It wasn't the same, and that has been very difficult on the older generations, especially those diagnosed with memory disorders such as Alzheimer's, and they don't know why their family is not visiting them. I have family members who work in nursing home settings, and hearing them say stuff like that, it breaks my heart. It does. Um, so the older generation has been hit very hard with COVID-19, not just physically but mentally as well. Moving on to stats on teachers' mental health struggles. Teachers have suffered a lot during COVID-19, as you can imagine. Being away from students and having to teach online has been difficult for a lot of educators. Last August, the National Education Association found that 28% of educators said the pandemic made them more likely to leave teaching. Of course, with the online learning, as we will see later on in a video, there are some teachers who have been teaching for a number of years who feel like they're in their first year of teaching again. A whole new normal, whole new system of how to teach our students. And of course, this is prevalent with physical education, because in physical education, it involves kids to be active, to be around each other. And it's difficult to do that from home. Of course, lack of equipment and that lack of team activities has been hard. Of course, staying active, trying to get kids to stay active while having to stay indoors, wear masks, socially distance. Later on in the presentation, I have a list of different activities that you can use in your physical education classroom through an online setting that kids can use equipment from home, at-home items for equipment to help them stay active while staying inside. This picture, upon doing research, I found that this percentage came from a region in Southeast Asia. Approximately that 70% of young people reported feeling anxious or very anxious about COVID-19. Of course, with young people, this has been especially hard for them as well, because they're young, they're trying to experience the world, and this COVID-19 pandemic rocks the world, and it turns their world upside down. Having to go to school online, can't see their friends, having to stay inside. It's been very tough on them because they are just growing into this, and this is going to be something that they're going to remember for the rest of their lives. And just feeling overall anxious, like, what is the next step? When are we going to go back to normal? Just like with everybody else. And so young people having to deal with this has been very hard. Very hard. Moving on to mental health statistics of K through 12 students here in the United States. This study, I want to say first that this study was done in 2015, but these problems still exist today with the online learning aspects. In this study, they found that 17% of teenagers had difficulty completing homework assignments because they do not have reliable access to a computer or internet connection. For students of color, that number spikes up to 25%. Again, even though this study was done in 2015, there are still problems with this around the United States. With the online learning aspects, not every student has access to a computer. Not every student has access to the internet. So it's very difficult to learn virtually, to complete assignments, tests, so on and so forth, which could lower grades, which, again, bringing that mental health aspect into there with the stress and anxiety, it just raises it through the roof. So again, very important to find ways to cope, find ways to make things work, and to stay positive during these times. So now I have a video regarding COVID-19 crisis here
as we hit another
with
milestone in this
health.
pandemic, and as so many of our lives remain upended, we take a look. As we hit another grim milestone in this pandemic, and as so many of our lives remain upended, we take a look now at how these uncertain times are impacting our children. Experts say the virus, plus the isolation of virtual learning and social distancing from their friends, all create a recipe for anxiety and depression. ABC's Ariel Reshef has this report.
Mad? Why do you feel mad, Buglet?
Because of this pandemic thing.
Their feelings so many kids are experiencing during these highly unusual times. 9-year-old Anderson Fields, one of an estimated 4.4 million children nationwide coping with anxiety amid the COVID-19 pandemic, and 1.9 million dealing with depression.
I want my kids to be okay.
Disruptions to daily life, school by screen, mask mandates, throwing off routines and throwing families for a loop. The youngest generation navigating the isolation and uncertainty of this new normal. Childhood anxiety already on the rise prior to the pandemic. According to recent studies, there has been a 17% jump in anxiety diagnoses in children 17 and younger over the past 10 years. And Dr. Dave Anderson of the Child Mind Institute says the current crisis is accelerating this trend.
So the research that we do have available during the pandemic indicates, stark increases across the entire population in anxiety and depression symptoms.
New Jersey mom Nishay Clark says she's seeing a clear impact on her 13-year-old daughter Taylor and her 9-year-old son Anderson, her youngest still struggling like so many others to adjust to all of this change.
My kid definitely needs structure, a lot of structure. And it's hard to create structure and work and get him through online school and manage his emotions and manage my emotions. It's just tough. And he's 9 years old, and how is he supposed to process all of this?
Nishay says she noticed a shift in her son's behavior as the pandemic dragged on.
What are some of the different behavioral patterns that you're seeing in Anderson that you didn't see before?
He's definitely more anxious. We've had a couple situations where even during just kind of the normal routine of the day, or once we were, with some friends, socially distanced at, a little backyard gathering, and he just kind of froze. And he said a scary thought went through his head. And, I went to hug him, and his heart was beating out of his chest. And I had to hold him for a little while. And he said, the world's really scary right now.
And the Clarks are not alone. Nishay is part of a network of families supporting one another, their kids sharing a similar experience. Her friend, New Jersey mom Cynthia Verhoev, says social distancing only enhances the anxiety her 6-year-old daughter Maddie naturally feels.
So my youngest in particular has had a challenging time adjusting to all of these changes. And some of the things that would normally put a kid that's more anxious at ease, you can't do. They can't really kind of play around with their friends or have their mom or dad stand next to them and walk them in. So it kind of sets the tone for just really kind of a buildup, right, of anxiety. And so you kind of have that element. And then when they get into the classroom, they're 6 feet apart and they're really tethered to their desks, which, for young kids is highly unusual. It's not what a typical first grade classroom would look like.
Dr. Anderson says he's seeing more kids suffering from varying degrees of depression and anxiety.
I think early on in the pandemic, we saw kids who were very, very worried about their parents getting sick. So little was known kind of at the outset about transmission and how that was happening that we saw kids who were very worried about, packages passing even within a few feet of people, even when they were outside. What we're seeing now is an increase in that anxiety as schools begin to reopen.
And experts say, especially now, it's critical to watch your children carefully for signs of emotional distress, even if they've never exhibited them before.
What you can watch first is body language, which is that if a kid is, about to confront a situation they may be anxious about, they're going to appear kind of inhibited, they're going to appear shy, they're going to be trying to avoid that particular thing. Some kids may even act out in advance of situations that they're anxious about, where they yell or they tantrum or they try to avoid it as much as they possibly can. Our repeated question asking, so a kid is looking for repeated reassurance, asking the same question over and over. Are you sure we're going to be safe when we do this? Are you sure that grandpa's okay? Those sorts of things. For kids who are anxious, we might see them have difficulty falling asleep just because they're anxious about what might happen that next day, or they're thinking about lots of different things.
And with millions of kids in the U.S. learning from home, experts say virtual schooling can exacerbate the psychological toll.
Kids will tell us they're worried that they're not able to maintain their focus as easily, or they get a lot more burned out by spending more time on virtual learning, or they're worried that they really can't seem to kind of follow the class because it just isn't the same format that they're used to or way of presenting material.
But while online schooling isn't perfect, Dr. Anderson says it is essential for kids to maintain a connection. And as for some concrete ways to ease your child's anxiety,
so what we focus on in therapy is exposing kids in very small doses to the things that they're afraid of. And for kids who don't have clinically relevant anxiety, you can do the same thing at home. If you're trying to help your kid confront their fears, what really helps after the fact is to remind them that it wasn't as bad as they thought.
Essential tools to help kids cope and families find their way through this extraordinary time. Ariel Reshef, ABC News, New York.
So in that video, you're seeing different, just seeing the mental health aspects and different behavioral issues that have come up with the pandemic. You saw with the 9-year-old Anderson, who at a small backyard gathering, just freeze up, saying that the world is a terrible place right now. It's a scary place. And so just checking up on children, students, making sure that they're okay, making sure that they're doing all right mentally, and just checking up on them, because just checking up on them, and anyone for that matter, can go a long ways. So now on the next slide, we will go through the teacher's point of view with online learning. And earlier on, I had stated that with the one teacher saying it was a completely whole new experience, you're going to see some teachers share their stories regarding online learning.
I bet over 1,000 emails.
Nick Ferroni struck a nerve when he posted a simple tweet. How many teachers are close to breaking down? Launching a conversation about how teachers are really doing.
Exhausted and burnt out, but need to keep providing the best education I can.
It feels like we're building an airplane while we're already in the air flying.
It's my 15th year teaching, is that I feel like a first-year teacher all over again.
We sat down with 3 educators for a candid conversation.
Do you feel like in some ways the kids' stress and anxiety is also something that the teachers take on?
Absolutely. Those are my babies. My babies.
Nick is teaching history remotely. Kelly Gallagher is a high school science teacher. And Nicole Mancini teaches 5th grade.
What is the toughest part about teaching during a pandemic?
When we think of our kids, some of them are taking care of their siblings. Some of them may have lost a family member due to this horrible virus.
Trauma that's even harder to heal remotely.
Some students feel safer walking around classrooms than they do at home. That's an aspect of education that we don't have right now.
On top of worrying about their students, recent surveys show nearly half of teachers say their own families are struggling, with 1 in 3 saying the pandemic has made them more likely to leave teaching earlier than planned.
It's okay to ask for help. It's okay to cry, because we have all done it so far this year.
Teachers are now connecting from around the world.
We've definitely gotten a little bit of that mentality of stronger together.
What is that silver lining that you're hoping for?
We now realize that schools are so much more than just schools to students.
In the springtime, when the kind of world of education was getting shook from its foundation, there was that sort of glimmer of hope, like maybe we could rebuild this.
Adapting and reimagining the classroom as teachers manage one of the toughest jobs of the COVID crisis.
I'm not giving up because we want the best for our students.
Vicki, teachers are doing such important work. How can parents support them?
Lester, if you know a teacher, check on them. An email or text goes a long way. As for teachers, mental health experts say set aside time for self-care. Make sure that you are away from work and email so you can recharge.
Hey, NBC News fans, thanks for checking out our YouTube.
So with this video, just important to what I've noticed is a lot of teachers using social networking, Facebook groups to help share ideas with online learning, especially with PE. With my advisor, Angie Williams, she has provided a lot of resources to us over here at VCSU regarding different ideas, speaking out, reaching out for help from other educators, and just helping each other out. Again, mental health issues, just speaking out on them, having someone to talk to, it goes a long ways. So here are some examples of some at-home activities / items that you can use in your FIAD classroom in an online setting. So the first one I have here is using water bottles for soccer goals. If a student has access to a soccer ball or a soccer-sized ball, they could put 2 water bottles up and practice shooting between those 2 water bottles. The second bullet point, letting students pick their favorite music to dance to. So allowing students to have that choice, just getting up and dancing, that's physical activity in itself. Get the kids moving, and they get to have a little fun with it as well. Calisthenic activities that could be done in one place. One thing that that Save America I've seen is a bunch of HIIT workouts, to where it's a bunch of push-ups, sit-ups. They have a certain number of exercises, certain number of minutes per exercise, and a little break, and that could be a great warm-up for the day's activities. Using soup cans or milk cartons as weights, for any high school teacher who is teaching a weightlifting class and they do not have access to weights, just using milk cartons or any appropriate weighted item around the house is a good substitute for weights. Number 5, obviously yoga. Whether or not they have a yoga mat or not, just give a little space, and just doing yoga. Not only is it a good physical activity, but it's a good mental health activity too, because it helps ease the body, ease the mind, and it's just overall a great workout to help with stress and anxiety. And then of course we have the last 2, using rolled-up socks as a stand-in for sports balls, and running up and down stairs if students have stairs in their house. So now I have a video. This one is from David Guterman, who is a PhD with the Cone Health Medical Group, and he has 6 ways in general on how you can cope with coronavirus stress and anxiety.
The coronavirus pandemic has presented us with a unique and challenging situation. It can create a great deal of anxiety and stress. Anxiety and stress to a limited degree can actually be very helpful. However, taken to a significant degree, stress can create problems for us both physically as well as emotionally. So when trying to manage your stress, there are a number of strategies you can utilize. It is important to really not focus solely on those things we cannot control. In fact, what you should do is have some discussions and think about and even list those things we do have control of. Make it something that you can do together as a family. And as simple as what you're deciding to watch on television, the things that you do during the day, what you're having for dinner. And those may seem like small things that we all don't even think about during the day, but when you're in a time like this, when so much of life feels out of control, those things can feel very comforting. Do not overload on information. It is, in fact, important to understand the facts and keep up to date on to what is going on. However, you don't want to overload by watching television 24/7, staying with the newspaper, all day long. You need to take a break from that information. Think about the things in your life that you've used in the past that have helped you stay calm. Listening to music or playing a musical instrument or reading, talking with family members. These are all the same kinds of things that will help you during this challenging time. Think about creating new routines, whether it's games or watching certain television shows. Try some creative, artistic kinds of things that would be fun and unique. Try to incorporate your children into helping you come up with suggestions of things that would be fun to do. It's really important to understand that, again, stress and anxiety is normal. Do not try to just push it away or pretend it doesn't exist. If we try to deny it and push it down, it sometimes can create really cumbersome feelings, and it becomes more difficult to hold it back than it is just to let it out. It's okay to talk about it, it's okay to acknowledge it, and that, in fact, will help you work through it. Look at each day as a unique day. We take it one day at a time. Be very present in that day and make it the best possible day it can be. And tomorrow, creativity takes over, you make an entirely new day. But day by day, you will get through this, and that's the best way you can manage some of the stress and the anxiety that comes along with this.
So those are some great ways to cope with coronavirus and stress and anxiety. I've utilized some of those myself. One that stuck out for me for us physical educators is coming up with new games for kids, coming up for engaging with your students on like possible new game activities that you could do in an at-home or blended learning setting. So just including your students, like letting your students know that you care, include them and ask them questions like, okay, new activity, what should we do, kind of thing. So that just stuck out to me pretty well. So I have another video right here regarding tips for educators. That one was the last video was just a general ways to cope with stress and anxiety. This one is specific to educators. As you can see on the side here, I have some things. First thing is you're not alone. There are many teachers around the country who have dealt with this. For us being in North Dakota, I know some of us in the smaller school districts have had school in person, so we've gotten to have that way of teaching back. That is, I believe, not the case for some of the bigger cities in North Dakota, and especially not in the bigger cities around the country. So knowing that you're not alone and that there are other teachers who are struggling, and that is why before I had said that it is very important to use networking, to talk with educators, help each other out with whatever is struggling or whatever you are struggling with. Some other things that teachers can do, of course, first thing is to pace yourself. For me, trying to rush to get everything in, content-wise, and just everything throughout the day, be sure to pace yourself and to stay mindful. And the third thing that I have is appreciate and savor the little victories that you get during this time of online and hybrid learning. Because with all the bad things, there are going to be some good things, and it's important to appreciate and savor those good things and to be grateful that those good things happen. But without further ado, let's look at some tips for educators for their mental health during high stress periods.
Hi, my name is Amin Azam. I'm a psychiatrist by training and at heart a passionate educator. I work at 3 San Francisco Bay Area health science universities, and I also work at Osmosis. Today, I'd like to talk to you about your own mental health during times of stress and or crises as you care for your students. I've got 3 key points. Number 1, engage in self-care. I'm a big fan of a metaphor of flying. When you're on a plane and the oxygen masks come down, the flight attendants always say, if you're traveling with someone who needs assistance, please put your own mask on first before helping others. And that's a beautiful metaphor of how we must take care of ourselves so that we can take care of our students. In times of particular distressing times, spending time, crafting time, even sort of prioritizing time on your own well-being allows you to be more effective at tending to your learners' well-being. Number 2, build and support your team and community of peers. So you are a part of a healthcare education team. There are staff, there are trainees, there are peer educators as part of your university or your program. So you need to make sure that you tend to the well-being of that community and make sure they're tending to your well-being. In addition to that, there are also professional networks. So I can think of, for example, the Dr. Ed listserv, groups on educational affairs from the AAMC. There are also education-specific educator and professional networks. So, for example, I'm a big fan of the Association for Academic Psychiatry, where I have peers as educators of psychiatry in other health professional universities around the world. Similarly, there's the Society of Teachers in Family Medicine, the Society of General Internal Medicine. There are other profession-specific educator organizations, and those are fabulous ways of building a network beyond your local community. And then thirdly, remember that we here at Osmosis are also trying to build a network of health professions educators globally. So we have a faculty listserv, we have a faculty development resources, we have an Osmosis professional enrichment network. All of those are designed to help you feel connected with others, and that community of peers will be a buffer to times of particular distress and a source of resource for how to handle that. Number 3, look out for signs of burnout and seek help yourselves. I know this goes without saying, but I have to say it anyway. Seeking help is a sign of strength, not a sign of weakness. So in fact, identifying your own workplace well-being resources is an extremely useful tool, not just in times of distress, but during your regular work days. So by that, I could mean things like anything like employee health or wellness or well-being programs, occupational health and human resources, and don't forget looking up your institution's policies on personal health and medical leave. Lastly, I'd like to talk about signs of burnout. It is important for us to acknowledge burnout in ourselves as well as our colleagues, and so I encourage you to think about signs of burnout. Some of the obvious ones that are worth saying: do you drag yourself to work? Do you feel cynical, and have you been irritated or impatient with people at work? Have you lost fulfillment in your career? Do you have low energy and or concentration, especially when you're on the job? Have your sleep and or eating habits become less healthy? And have you had any unexplained physical symptoms like headaches or stomach troubles? Identifying those signs of burnout early are important so that way you can mitigate them and seek help yourself. All right, so as a quick recap, we as educators must manage our own mental health in order to be there for our students. Remember to 1, engage in self-care, 2, build and support your team and community of peers, and 3, look for signs of burnout and seek help yourselves. I hope that was helpful. If you don't have the resources you need at your school, or if you have questions, please reach out to us at partnerships@osmosis.org.
So with that video, he gave really those 3 tips that truly, I believe, can help reduce the mental health issues that any mental health struggles that educators have. Making sure that you are taking care of yourself, so that way you can take a good care of your students. And of course, if you are struggling, watch signs for burnout and ask for help as needed. So now I have on this slide some resources for teachers and students. Shape America and the American Psychological Association are both great websites with resources to help teachers during these difficult times. The resources included on these websites, some of them are self-care, instructional videos, safe space ideas, and vaccine confidence. Of course, like we stated before, it's important to take care of yourself before taking care of others, making sure that you are 100% all right, so that way you can help someone get to 100% as well. Some instructional videos on Shape America on how to incorporate COVID type activities, activities that can work through the pandemic. And then of course that last one with vaccine confidence, that just as a nation, people are divided on the vaccine. So again, using those resources to, if you ever have time, look them over. Shape America and the American Psychological Association both have great resources that can help you in your career, in your school, regarding the times that we are in right now with COVID-19. So in conclusion, COVID-19 times have been difficult for all of us. It is important to remember that you are not alone when it comes to stress and anxiety caused during this new normal. There are many ways to cope. If you need help finding your way to cope, make sure to seek help and help each other along the way. And also, like we have stated before, using resources from the internet, from family members, friends, just to help cope, making sure that your self-care is top priority, so that way your care of others can match that along the way. So thank you for all the educators and students that have decided, or that came to my presentation today and heard what I have to say and show. Again, this topic is very important to me, and I figured it was important to share this with all of you, especially in these trying times that we are all going through, and to see the mental health sides of things, so that way we can flourish as educators and as students in these difficult times that we are all going through. Here are the references that I used for this presentation. And lastly, I have a Q&A that will be set up in the chat box. So for the remainder of this presentation, feel free to ask any questions that you have on the presentation, or about me, just any questions in general regarding mental health or COVID-19 into the chat box, and I will get to each and every one of your questions before the session is over. Again, thank you for taking the time to listen to my presentation. I hope you all have a good rest of your school year, and yeah, thank you.